To see circulating illnesses it's not really surprising to see more than one circulating illness at one time. We are in a typical flu season. We're on track to have a normal flu season like we've had in many years prior to COVID.
Right now, 3 different viruses are spiking a national spike in illness. Health experts say this tripledemic, as they call it, is a result of rising flu, COVID-19, and RSV cases. So how is East Tennessee handling this barrage of bugs? We asked the Department of Health. It says 76% of hospital beds are now full. Here in Knox County, about 2% of staffed inpatient hospital beds are occupied by patients who have COVID-19. The latest data from November 23rd shows about 278 new cases and fewer than 10 deaths. Health experts say COVID symptoms typically include muscle and body aches and shortness of breath. You'll notice symptoms about 3 to 4 days after exposure. Right now, Knox County remains, though, at low risk for that virus. Now to the flu. Those symptoms tend to develop more suddenly than COVID or RSV. They include a runny nose, fatigue, and fever. Right now, Tennessee is at a very high risk for the flu. You can see the state, it's marked in purple on the map right there. It is the latest data from the CDC. The Knox County Health Department says it's normal to see a high number of flu cases this time of year. When it comes to RSV, health experts say the illness targets babies, especially children under the age of 1. It also hits adults 65 and older with weakened immune systems. Doctors say because RSV is not a reportable illness, it's not as easy to track the data. Symptoms can vary, though, based on age. Health experts say we might see an increase in RSV cases in children because of the return to school and socializing. So the best way to stay healthy is to stay up to date on your COVID and flu shots. The Knox County Health Department is offering those vaccines at both of its locations, and they say the best safety step is just to stay home if you're sick.
Do your job, do your part for the community, stay home if you're sick, try not to spread that to others. When in doubt, if you have a low-grade fever, stay home. Wash your hands if you're planning to travel for the holidays. Rethink if you're not feeling well that you may want to stay home just to protect those loved ones around you that may be at higher risk, those who are elderly or children under the age of 5.
Other tips, what you just heard, wash your hands frequently. Also, wear a mask to keep yourself and others safe if you're sick. Health experts predict another spike in illnesses after Christmas, especially during January when, of course, it's going to be getting colder and people stay indoors more so.